There is new information now into our continuing investigation into Augusta State's medical prison, the facility plagued with allegations of deplorable conditions and subpar health care.
The warden was removed, but as Maxwell tells us in this News Channel 6 special report, the problems may stem from higher up in the chain of command.
Augusta University is well known for all the good it does in the community, its medical research and its healthcare facilities. But it has a lesser known branch that's responsible for $185 million taxpayer dollars in the medical care of more than 50,000 people, Georgia Correctional Healthcare. Dr. Tim Young worked as a physician under GCHC for 16 years at Augusta State Medical Prison.
That is a lucrative contract for Augusta University. It is probably in a lot of people's best interests that that contract stays open and the money keeps flowing uninterrupted, and the less noise that is made, the better.
Dr. Young says GCHC has been complicit in poor health care for inmates for years, so poor that people die from treatable issues because they aren't seen in time. He believes it constitutes cruel and unusual punishment, a violation of inmates' Eighth Amendment rights. A few months ago, a court also came to that conclusion. In the case of Mike Tarver, a convicted murderer, he won $550,000 in a settlement from the state of Georgia after a small cut on his leg resulted in amputation. Georgia Correctional Healthcare stood by the doctor that he singled out for deliberate indifference, but she later resigned. It was an unlikely case, filed from prison by hand with no attorney. However, his lawsuit proceeded, and he eventually ended up hiring Augusta attorney Mike Brown.
Mike had done an extraordinarily good job of going through the law library, finding the right cases, and had done an exceptional job of litigating the case himself.
But usually cases like this don't get very far. Brown says aside from an internal grievance process, inmates don't have much recourse besides federal court.
It's not the only, but it's the primary. It's very difficult to access any of the other avenues. There's nobody overseeing what the GDC is doing in providing health care.
Georgia Correctional Healthcare pays a nonprofit physicians advocacy group called the Medical Association of Georgia to audit its facilities every 3 years. But these audits aren't mandatory, they're voluntary, and it's unclear if there are any consequences if they fail.
As far as I know, they answer to no one.
In 2017, an audit of Augusta State Medical Prison found that the medical staff was at a 65% capacity, but it still passed. In 2013, the Medical Association of Georgia gave the prison 3 chances to pass over more than 6 months. Some of the issues included insufficient emergency plans, insufficient inmate death reviews, and insufficient records of drugs.
Prison health's a mess. It's a terrible condition.
Dr. Young places the blame for the facility's problems at the feet of administrators, both at the Department of Corrections and Georgia Correctional Healthcare. He says the organizations are top-heavy, paying administrators 6-figure salaries while inmates languish. Brown says the fault lies with us as a society, and how many people we incarcerate and how little money we spend on their basic human needs.
I hold the people who are down there at the legislature ignoring this problem, ignoring other problems.